Let's talk about the difference between normal hair loss and pathological hair loss. Now you have hundreds of thousands of hairs growing on your head at any given time. The life cycle of hair is between 2 and 5 years. In a normal situation, the average person loses between 50 and 100 hairs every day. So the way you're going to find out is if you run your fingers through your hair with a gentle pull, and you should see between 1 and 10 hairs in your hand, and that's normal. But if you keep doing the same thing over and over, and it keeps coming back, there are several reasons for that. The biggest reason is that there's some kind of hormonal change going on. Let's say you just had a baby, or you're going through menopause. That means your estrogen is high and your progesterone is low. Also, if you have high levels of a hormone called DHT, which is a powerful form of testosterone that can cause hair loss. That condition is called alopecia areata. Then if your thyroid is low, that can also cause hair loss. Most cases of hypothyroidism are autoimmune, and that would be Hashimoto's. So this is not really a thyroid problem. It's an immune problem. I've put some links below for more information on that. And now if your cortisol is really high because your stress is really high, that can also cause hair loss. Also, some medications can cause your hair to fall out, especially birth control pills, which are also antidepressants that have estrogen in them, and anti-anxiety medications can also cause hair loss. And in addition to taking insulin, if you have diabetes, that can cause hair loss. Now, if you have an autoimmune condition called lupus, that's one reason, and another big reason for hair loss is nutrient deficiencies. So if you're low in vitamin D, B12, vitamin C, vitamin A, especially zinc, which is very common in biotin, which usually comes from having some issues with your gut. Let's say you're on antibiotics. For example, that's going to kill the microbes that actually make biotin, and that can lead to hair loss. I have a video on that, I'll include it below. Also, if you're low in selenium, which is a mineral that helps you convert T4 to T3, which is the active form of thyroid hormone. So that can cause a problem with the conversion of the thyroid, and that can lead to hair loss.